Welcome to the Pennywise Financial Podcast. This is Constantine here, Monarch Wealth Management, with my co-host Dave Georgiev. And Dave, why don't you go ahead and introduce Brenda?
Yes. Well, we have a Medicare specialist, Brenda Foster. Brenda, welcome to the show.
Thank you. Glad to be here.
Yeah.
Brenda, you're from the Medicare Marketplace.com.
Mm-hmm.
So why don't you start with a little bit about your background, how you got started, and what you actually do to help people?
Okay. Well, I started in Medicare. This will be my 6th annual enrollment is kind of how we count it as agents that do Medicare. Annual enrollment is October 15th to December 7th, and that's our busiest season.
That's coming up soon.
Yeah, it's coming up. I'm entering my 6th one. And actually, the way I got started in Medicare is interesting. My husband was taking an early retirement from his career job, and we actually were consulting with Dave to help us do that. And I was shocked to find how confusing and stressful retiring really was.
Oh, yeah.
So I like to, when I do some Medicare 101s and talk to groups, I like to say that they say the 2 most stressful things in life is buying your first home and having your first baby. And I would say the 3rd thing is retiring.
Yeah.
So, and people don't realize that it just hits. And it did for us. It was like, you're trying to figure out and maneuver and can't you, what are you going to do? What are you not going to do? And then you add Medicare and insurance on top of that. And it was very confusing. So when we went through it, at the time I was thinking I was going to try a little something different while I'm a little bit younger than my husband. So, he was retiring and I was going to do something new. And actually Dave, after going through the process, said, Brenda, why don't you do Medicare?
So he pushed you to work.
It was him.
Okay.
Well, it's like her personality. She's just, as you can see, just bubbly, like easygoing. And I'm like, you do great with human beings, which is the number one. Like, you can learn anything under the sun, but if you can't talk to people, I don't care how smart you are. And like Brenda had that natural like vibe with people. And I'm like, you would actually do great at this. And if you remember, I brought a Medicare specialist, I'm doing air quotes, to your house, and he was horrible. Horrible. And I'm just like, Brenda would run circles around this guy, you know? And you know.
Well, so that's kind of how it started. So I didn't do it right away. I thought about it for about 6 months. And then I said to my husband, I think I'm going to go get my license and my insurance and get certified and all the things you need to do. And Dave thankfully put me in contact with Jane Ahrens, who is, we call her the mother of Medicare. And,
Mother hen.
I like that.
And she's amazing. She's been a blessing since the day I met her. And she mentored me and taught me how to do it right. And I absolutely love it. I love what I do. I feel like I work with the best demographic of people there is. They are just wonderful, need the help. So you know that you're really helping somebody. And it's challenging. It's mentally challenging job, but I like that.
There's a lot of moving parts. You talked about retirement and having a baby and buying a house. Those 3 things people do usually once, maybe twice in their life.
Yeah.
Buy a house. Maybe it's not your forever home. You go in and buy something else. That might be it. Retirement. You think of like Tom Brady. You think of people that go into retirement and come back out and retire again. Usually you do that a couple times in life, but without the practice, you don't really know how to navigate things. Yeah. And there's all these other components to it. And I want to hear more because I don't really know that much about the options for folks when they retire.
Yeah.
As far as Medicare, Medigap coverage, what does that mean?
Yeah.
And healthcare, any kind of insurance product, Dave, and I don't know how you feel about this.
Mm-hmm.
It's so convoluted, so confusing from the basic cell phone insurance. Like, what does it cover to home and auto?
Yeah.
A tree fell on my car. Is that covered? Oh, well, not really, because it came from your neighbor's, like all kinds of like nuances.
Yeah.
There's all these nuances that people, I think, need guidance from a professional to tell them what's covered, what's not, what you should be thinking about as far as out of pocket. And we're just going through, I think of a mutual client that we're going through now in their plans. And one of the things that comes up is health insurance.
Yeah.
Right?
Early retirement, retiring around 62, 63.
What do you do?
What do you do for 2 or 3 years? How are you winging that? You know? And unfortunately, today's world, you can't just wing that because the cost is crazy. It's astronomical.
Right.
And so I guess I would ask you, Brenda, coming into this new open enrollment season for 2023, are there any new, I'm going to say bells or whistles for lack of knowledge of the details, to the Medicare plans this year?
And wait, before you even get it, what is open enrollment for people that don't know? What does that mean?
That's a good one.
Good. So open enrollment is October 15th to December 7th. And it's actually called annual enrollment by Medicare. And it is the enrollment period during the year that everyone who has a Medicare plan, on a Medicare plan, can make an annual change. All right.
And you have to be 65?
So you have to have Medicare.
You have to have Medicare.
You have to have
already.
Medicare. There's 3 ways you can get Medicare. When you're turning 65, you can get your Medicare. If somebody continues to work after 65 and stays on an employee group health plan, when they get off that and retire, they can get their Medicare at that time if they didn't get it at 65, or if they are disabled and on disability for 24 months. After that, you can also get your Medicare.
You have to be full disability?
Disability.
Okay.
Yep.
Okay.
Yep. So anyone who has Medicare for any reason during annual enrollment is the annual time that you can make a change to your plan. So when you have Medicare A and B, and A is your hospitalization and B is your medical. You always put something with that. That's the Medicare, the parts of Medicare that you get from the federal government. But there's Part D, which is prescription drugs that you get from private insurers contracted by the government to sell their Part Ds. And then there's Part C, which is not really a part. It's, I like to think of C standing for the word combined. It's when you take your A, your B, and your D all together and they put it into one plan. And private insurers sell those plans and they're contracted with Medicare to do that. So there's a lot of regulation and compliance that goes with that. So every year, if they have a Part C or they have a Part D, they can change those plans to other plans this time of year.
And why would somebody want to make a change? What is it? Coverage? Is it premiums? Is it a combination?
It's a combination. So actually what we do this time of year as agents is we send a letter out to all of our clients, just sent it, and we let them know it's time to come in for an annual review. And we ask all our clients to come in and see us so that we say, how'd your plan work for you? Somebody has a Part C Medicare Advantage plan, which is a plan that combines everything. How were your copays? Did it work for you? Did you have ancillaries that you need? They might include dental, vision, hearing. What other things? Sometimes people encounter a year where they came up with a chronic illness and maybe that type of plan is not enough coverage for them anymore. And we have to move them over to a Medicare supplement or a Medigap, which means the same thing. So it's a review every year to make sure that they're still where they're at and to review what changes, because every year there's usually changes to every plan. So the insurance companies send them what's called an ANOC, an annual notice of change, to tell them what the changes are going to be to their plan. Well, they know what those changes are, but what about all the other carriers and all the other plans? So they come in to see us so that we can look at all of it for them and get them in the best plan every year.
How do you even manage all that? Is there like a software? Do you just know it in your head? Like, how does that happen?
It is a lot. It is a lot. We actually have to certify with every carrier that we are a broker for. So, Excelis, Aetna, MVP, United Healthcare, we have to take tests and certify every year and pass them to continue to sell their product.
So Brenda, with that, you're like an independent agent, so you're not beholden to like a United or an Excel?
I'm an independent broker. Okay. So basically I work for my clients. I'm paid by the carriers, but I'm not a captive agent for any of them. I certify with all of them because I wouldn't be doing you any good if you came in to see me and I only sell one company.
I agree.
Yeah, totally.
So that way we have all of the options for everybody. And maybe for somebody it's premium. Maybe for somebody it's certain benefits. If they're snowbirds and they go to Florida, they don't want to be in an HMO. They want to be in a PPO where they can go out of network and the plan has a national network option. Things like that.
Yeah, that's a lot to know. That is really a lot. I couldn't imagine navigating that on my own. Well, I'm thinking of even my in-laws, like if they have anybody to help guide them with that kind of stuff.
Yeah.
And so Brenda, you said something that's pretty important for like our people listening. It doesn't cost the client any money to meet with you.
Nothing.
Nothing.
No,
So it's
we are paid by the insurance carriers.
So regardless of the insurance company, one company doesn't pay you more than another. So you have
it's regulated.
Yeah,
it's regulated by the Centers for Medicare and Medicaid.
Yeah.
And so when you call people or invite people or send out a flyer and invite them in for a quote unquote review, you're not motivated to make a change. Like if they make no change at all, it's not like
doesn't impact me at all
financially. Okay, so
it doesn't impact me at all. I mean, but there's plenty of times that maybe your mom or your in-laws or somebody would call and say, "Hey, would you give me a review?" And they come in to see me, and where they are is exactly where they should be. That they're not going to become my client, so I'm not going to get paid on them. We still would tell them, stay exactly where you are. I mean, our job is to help them stay. Whenever I am across the desk from somebody, I just always think, if you were my mom and dad, what would I want this person to do for my mom and dad? And that's what we do for everybody.
I like that a lot. So open enrollment is not necessarily for the folks that are retiring. So if I have to retire within that time frame, it's the folks that already have a plan.
That's
They're
correct.
already 65.
Yes.
They're already on Medicare.
When you're retiring, you get a special election period to get your Medicare if you hadn't already, or if you're just turning 65, then that's called initial enrollment period. You don't need the annual enrollment period.
So my birthday's in January. Fast forward time and I'm turning 65. I want to retire that year on my birthday.
Yes.
So I would have that special election period.
Yeah. So your Medicare would start, if your birthday is in January, your Medicare would start January 1st. It starts the first of the month of your birthday month.
Okay.
And you can enroll in Medicare 3 months before your birthday month and 3 months after your birthday month. That's your initial enrollment period. You don't need annual enrollment. That is your 7-month enrollment period.
What if you miss it? Like, what if you're like, I'm still going to keep working, and you don't sign up for Medicare?
So if you're still going to keep working, as long as you work for a company that covers you with credible coverage and is an employer of more than 20 employees, then you don't need to take your Medicare. So when you go to take your Medicare, you prove that you were covered and you're fine.
But you still have to go through that process.
You still have to get your Medicare.
Okay.
Yeah.
Gotcha.
You have to go get it, or you have to apply for it online or go down to the local office.
Gotcha.
And what about the premiums for, like, is my Social Security reduced by any cost? It is.
So Part A is free for most. Part A is free if you worked 40 quarters, 10 years, your whole life.
Okay? What does Part A mean?
Part A is hospitalization. Part A covers hospital, hospice, home care.
So basically like catastrophic type scenario.
You're in the hospital. So here's how it works. If Part A hospitalization, just Medicare, if you have just Medicare A and B, even Part A hospitalization has a $1,600 deductible for every benefit period that you would go to the hospital. That's what we do, is we have the products that you coordinate with your Medicare A and B so that you can avoid that deductible, so that you can have that deductible covered either by a Medicare supplement or within a Medicare Advantage plan. So Part B is your medical, and that carries a premium that you pay every month and is deducted from your Social Security check. If you're not collecting Social Security, they bill you quarterly, because people don't realize that they can take their Medicare before they take their Social Security.
Yeah, I didn't know. So they would send you a bill.
They will send you a bill quarterly for this year. It's $164.90 for Part B, and they will get a bill quarterly for that. Once they start taking Social Security, it comes out of the check every month. So it's probably going to go up about $10 this year, I guess. Usually we know about October, November what it goes up to. So maybe it'll be about $175 next year. We don't know yet. That's just a guess.
Okay. And then Brenda, for like supplementals, and I'm probably using the wrong terms, supplemental plans or Medicare Advantage plans, aren't there different types of like plans you can sign up for? So like if you're younger and healthier, where you have less deductible or lower monthly premium or no monthly premium?
Yes. So in a very high level view of it, people who have, I would say, chronic illnesses and a lot of medical needs typically go with a Medicare supplement. Okay. So what that does is that takes your A and your B, your Medicare, which is basically 80-20 coverage with no max out of pocket. And what that Medicare supplement does, and it's called a Medigap. Medicare supplement, Medigap are interchangeable words. Okay. It fills the gap that Medicare doesn't cover. So it covers that 20%. It's basically just a secondary payer. So Medicare pays first, the Medigap pays second.
Yeah.
Those can be about $300 a month.
Okay.
On average.
Okay.
There's different plans in them, but I'm just high level, about $300 a month. Somebody who has a need for that, it's well worth it. Okay.
So what happens if you're paying the $300 a month? Does that cover everything?
So anything that Medicare covers, you go to the doctor, Part B would pay 80%. The Medigap would pay the 20%. You go to the hospital, 80%. The rest would be paid by the Medigap. It doesn't cover anything that Medicare doesn't cover. So you don't get any of the ancillaries. You don't get dental, vision, and hearing, which Medicare doesn't cover. You don't get a gym membership. You don't get those kinds of things.
Sure.
And you have to get your own drug plan, where with the Medicare Advantage plans, your drug plan is in there. So it's a higher monthly cost.
Yeah.
But it's full coverage.
Yeah.
It's full coverage. Okay. Somebody very healthy, doesn't have a lot of needs. They can go with a Medicare Advantage plan. They might be zero premium.
Sweet.
The reason they can be zero premium, which is probably what you're going to just ask me.
Yes.
Is
you saw me. You saw the look.
The reason they can be zero premium is because these Medicare Advantage plans come from the insurance carriers that are contracted with the government to provide Medicare. They have to cover at least what Medicare covers. Has to be the basics. So the government sends, say you're going to get your Medicare from a carrier through a Medicare Advantage plan. The government sends that carrier money every month to manage your Medicare. They take that bucket of funds and they make these Medicare Advantage plans very nice and attractive with benefits that Medicare doesn't cover, like dental, vision, hearing, gym membership. Your drug plan is included in it. Okay. Some of them are zero premium because now you pay copays. If you go to the doctor, you might pay a $40 copay. If you go to get an MRI, you might pay a $300 copay. There's copays associated, where on the Medigap side of things, it's primary payer, secondary payer. You're not going to pay anything for what Medicare covers. Yeah. So they're zero premium because that's how they're structuring that plan for you, because they're getting paid by the government to make that plan attractive. Some of them have premium, some of them don't. There's a lot of zero premium plans.
Wow. You mentioned two things I'm not familiar with. Zero premium plans, which I haven't. Wow. I'm going back 10 plus years. And the other thing is copays. I haven't done that. I'm on high deductible. So I'm paying out of pocket for everything. Young and healthy, knock on wood.
Yeah.
So it's not a problem. Wow.
That's loud.
Yeah, it is. Really loud. So yeah, those two things are foreign to me because I self-employed.
Yes.
Premiums are extremely high.
Yeah.
Higher than my mortgage, which for a family, I mean, I don't know how other people do it.
It's crazy.
And we're talking about pretty much catastrophic coverage.
Yes.
But you couple that with an HSA, you're young and healthy, you can build that up. And I think of my younger folks who have these HSA, which is kind of newer, saving, paying for their expenses out of pocket, because you can get reimbursed at any point throughout your life. And that money comes out tax-free. And the nice thing is people can do that for young, healthy folks who have high deductible. And they'll have a nest egg later on.
That's a great idea.
$500,000, $1 million.
Yes.
And they can get reimbursed at any point and invest that money. Let it grow and then take it out tax-free.
I think a lot of people don't even realize they can do that.
They don't.
So many advantages.
And it's kind of scary, like to go from a copay plan. When we were at corporations, when we worked for a bank, we had copay plans and it was great coverage. But I don't even think they offer that anymore.
No. And at the end of our employment, even when we were at M&T before we became independent, it switched, though. I remember the one year.
It's cold turkey, right?
Yeah, cold turkey. So it's like, hey, last year you were copay and everything was kind of cushy. This year it's high deductible and good luck.
Yeah. I know when people come over to Medicare and we tell them, like with a Medicare Advantage plan, they have what we call a MOOP, max out of pocket. And the max out of pocket might be $7,500. They confuse that in thinking that's their deductible. There's no deductible. There's no high deductible with Medicare like that. When you have the Medicare Advantage plan, the MOOP is your max out of pocket that you would spend on copays. Once you spend that, the plan pays everything.
Fully covered.
It's the opposite.
Wow.
Yeah.
Well, in a real life story. So when my mother-in-law was still with us, she had cancer. And so she was on a lower premium plan.
Medicare Advantage plan.
And she starts getting these bills for like $5,000, $6,000 for chemo. And I'm like, we call her Mima, that was the grandmother. And we're like, Mima, you got to talk to Brenda. And I'm like, because I know for sure there are plans, they cost more monthly, but it takes care of everything. And if you're going for radiation and chemo and all this stuff, like these bills are going to get
Expensive.
huge. Yeah. And Brenda came in, put her in one of those plans that have the higher premium. No more chemo bills, no more nothing. I mean, you're paying I think it was $250 or $275 or whatever it was.
Right.
Everything's covered. That poor woman was in and out of hospitals for the last 6-8 months of her life.
The Medicare supplement or Medigap is the only way to go with somebody with treatments and chemo and that kind of thing.
And so, Brenda, my question to you is like, I remember something about a caveat because once you sign up for a plan, so she was in the lower monthly premium plan before, and then it wasn't open enrollment, but you got her into the.
So there are special election periods that we can use.
Okay.
One of them being there's a state pharmaceutical assistance plan called EPIC. And if you are a member of EPIC, if you qualify for it, it's free. It gives you one special election period a year to make a change to your plan. And so we use that to change people's plan when they have a situation like your mother-in-law and get them changed.
Yeah. And that's wonderful. And that's kind of the mindset, I guess. And Brenda, you're the specialist, so correct me if I'm wrong. If you're young and healthy and you retire at 65, 66, whatever it is, and you're healthy, maybe you start off with the 0 premium Medicare Advantage plan.
Yes.
But then as you get older and your health starts to deteriorate, you look at shifting to some of those other plans.
I have people in their late 80s still on Medicare Advantage plans. And the way some of them look at it is they've been on a Medicare Advantage plan for 15 years, maybe a 0 premium plan. So if they got to the point where they had a $5,000 bill with, maybe ending up in a skilled nursing facility for, some time or whatever, they figure they've
saved all this money.
Right.
Yeah.
Right. Yeah. It's not, there's other pros and cons to why you would choose one over the other. If we were going to really get into it, there's other pros and cons to it, but that's the basics of it.
The 101.
That's a lot. I mean, I couldn't imagine doing this on my own.
Yeah.
No, and that's the thing. I literally sometimes people come in to see us and they actually don't even know whether they have a Medicare supplement or a Medicare Advantage plan. They don't know what they have.
I can see why.
Yeah.
They actually don't know what they have. It's confusing. Yeah. And that's why it's important for them to know what they have and to know what their options are and what's best for them. There's not only one way to go, there's different options, but I actually, one thing I want to mention about using these options, we can do that in New York State, but in every state you can't do it.
Oh, really?
So in New York State, it's what we call guarantee issue. So people can get a Medicare supplement at any time and they can't be denied it. In other states, you can be denied a Medicare supplement based on health questions or age. Wow. So in other states, you want to get into a supplement when you're healthy and young and keep it. Where in New York State, it's guarantee issue, so you don't have to, which is one of the reasons why our premiums are higher.
Gotcha. That makes sense.
Yeah.
But doesn't that kind of, not that people take it, but to live a healthier lifestyle? Like I can save money if I live a healthier lifestyle. And honestly, quality of life improves so much more because you're not spending the last 15, 20 years of your life in doctor's offices, right?
Yeah.
I mean, that's the way that our medical... Truthfully, that's the way that our medical profession should be educating us, right? Yeah. Instead of it's all these, I don't feel good. Take a pill. Like, no, change your lifestyle so that you don't have to take that pill.
Yeah. But, no, I agree. And one of the things that I try to do for all my clients is I give them the list of preventive services that are 0 cost to any Medicare beneficiary. Yeah. Take advantage of them. Yeah. Annual physical. Get an annual physical. Make sure you're always checking up on everything. Yeah. It's very important.
For sure.
And the insurance companies will call them regularly. They want to do a health assessment, ask them some questions, and do they have to keep calling me? I'm like, it will save them money if you stay healthy.
Sure it will.
And it's good for you to stay healthy. So I encourage you to answer those questions.
It's a win-win.
And it's actually, yes, of course they want to save money and they don't want to spend a lot of money on you, but it's for your benefit too. So the health assessments are actually a good thing. They'll do a home visit. Obviously here, we don't need a home visit so much. We have hospitals everywhere, but rural areas need it, Yeah. So I encourage to go towards staying healthy, do those things.
Yeah. Quality of life.
Yeah.
Absolutely. Yeah.
With that, let's take a quick break and we'll be right back with the show.
Retirement income is not an end game. It's only part of your planning. It's meant to carry you through a long and big part of your life that can't be filled with worry or concern that you'll outlive your money. The last thing you want to worry about after working the past 30 to 40 years of your life is money and having enough of it. Listen to our show and schedule a consultation to learn more about how we can give you the confidence you deserve so you can focus on the things you truly enjoy.
Welcome back to the Pennywise Financial Podcast. Constantine here with my co-host Dave Georgiev and our guest Brenda Foster. You mentioned the Medicare Marketplace and some of the things that you help clients with. What else do you do? I know there's other things that you help folks with.
So our website, the Medicare Marketplace, is where we're brokers. We're insurance brokers that sell the Medicare products. So it's not a Medicare site. We don't represent Medicare. We're independent brokers, and that's what we do. So we can sell the products, the Medicare Advantage plans, the Part D plans, the Medicare supplements. But beyond that, the way that we as brokers view it is, our book of business and our clients, they're our family. And so we're there. We help them all year. So we're advocates for them. So if they we're prescribed a new drug and they want to know what it's going to cost them, they might call me from the pharmacy. What's this going to cost me today?
Really?
Oh yeah. We'll look it up for them, help them find doctors, help them with billing issues. Every week I hear from clients, my current clients, to help them with different things. They basically call us before they call the carrier sometimes.
Wow.
Yeah.
You got at the top of the show, we talked about special election periods and changes. Is there something that's tied to life-changing events like a divorce or married, or because I feel like I had a client that was going to get divorced.
You're talking about Irma. Are you talking about
Maybe I am. I don't know what I'm talking about.
Okay. Well,
I don't know what I'm asking, I guess.
I'm thinking you might be talking about the income-related monthly adjustment amount. So
good old Irma.
So you're familiar with Irma. I don't have to tell you about Irma, right?
It's not very popular in our
no.
So there's a form that they can fill out if they had a life-changing event that changed their income now from when they're looking back on 2 years that might get them out of Irma. I thought maybe that's what you're referring to.
It may be. Yeah. I'm not even sure. I remember there was a reason where I had a married couple that was considering getting divorced. And there was some kind of benefit. I don't know if it was on the medical side. I don't know.
Probably Irma, so that possibly their income changed. They didn't want to be subject to paying that adjusted amount because you pay it on your Part B and your Part D.
Oh, so your Part B and D goes up?
Yes.
Like in an Irma type situation?
So if a single person is over $97,000 a year, a couple is over $194,000, you pay Irma. You don't pay the $164.90 for your B, you pay more than that. And it's graduated by your income, but you also pay an Irma on your Part D as well. Wow. People don't realize that. Yeah.
But is that, do you think that, just asking, do you think that that's bad? You're making more income, substantially more income. And there's like a penalty for success. Is that good or bad?
I don't know if it's a penalty. It's
but it is, right? You pay more because you make more.
Like a tax almost.
Yes.
Yeah. I had a new client that came in one time, and he I didn't know him at all, and he was just a regular guy, obviously like working in the field, had a farm, and I got to helping him, and he said something about his Part B was $450 a month. And I said, no, your Part B is not $450 a month. It's, at the time, whatever it was, one something. And he's
you don't know what you're talking about.
I sold some property, and so I'm paying Irma. Like, okay, well, that's what happens.
Yeah, that is what happens.
Yeah.
I have one client who will, for the sake of better terms, go to hell and back to avoid Irma.
Yeah, well.
And every year she's right around that Irma, and she's like, where can I, tuck this or put that? I'm like,
she tiptoes right by Irma.
She dances by Irma. Yeah. Irma's sleeping in a rocking chair.
I like it.
Yeah. Yeah, when we do the Medicare 101 presentations, when I get to that Irma slide, I'm always just like, okay, here come the questions.
It's so funny.
Here they come. Irma, old Irma.
Yeah. That's what I picture. Like an old crotchety lady in a rocking chair ready to yell at everybody.
Yes.
A question comes to mind about planning. How long does a typical meeting last?
Funny you should ask. A typical meeting, it depends on the agent or the broker. I am teased by my coworkers. They want to know what I talk with my clients so long about. My typical meeting is 90 minutes. It can be done in a half hour, 45, depending. Somebody's just coming in for an annual review and they're good where they are. They just want you to recheck their drugs, make sure the formulary is still good. There's not a better plan to cover the expenses of their drugs. 30 minutes, 45 minutes if it's for two, a couple. Somebody new to Medicare, 90 minutes. Because you're literally bringing them through the whole process and explaining to them how it works, what their options are, and then going into their specifics to break it down to these would be the best options for you. So I would say 90 minutes.
Wow.
Yeah, I believe it. I mean, and you're doing annual reviews. I kind of wish I had, they all promise it, but an insurance broker on the P&C side that would do that and say, hey, let's look at what's going on in your life. Let's see what your premiums are and what coverages you have. And can we bundle this or reduce the premium? We don't have that. I mean, they don't make enough money though. There's not enough money there for those agents to be able to do that. I mean, they have a massive book, 2,000, 3,000, 4,000 clients, and they make 5-10% of the premiums. If you pay, $800 a year for your auto insurance and maybe another $1,000, they're making maybe $200 for the year. Yeah. They can't afford to spend 90 minutes.
Yeah. And even when they come in to discuss, their options, they might come in and say, I just really want some better dental this year. Or believe it or not, a lot of people will be like, I just want a free membership to the Y. And so it's a time to just say, well, first we want to make sure you have good medical coverage. Let's pick it based on medical. Right. And all your medical needs, and then we'll break it down to now these are the best for what your medical needs are. Now, which ones have dental and which ones have a gym and which ones, so that you can watch the advertisements on TV and Joe Namath and those things and think that you can just get all these things, and it's not.
Gym membership,
it's not accurate.
I mean, they used to be. I mean, that's got to be one of the maybe less valuable options, I would say, in any of those plans, because it used to cost maybe $65-$75 a month for a gym membership. Remember that back? I'm talking like 15 years ago. Yeah. Now you can get a gym membership for like $10 a month, just about anywhere.
Baby, Planet Fitness.
Right,
Yes.
Planet Fitness,
World Gym, Gold Gym.
But they still have those like super duper expensive ones, like that Orange Theory in Pittsburgh. I mean, I think that's like $100 a month. You go to any
I can't imagine a retiree wanting to do
the Y
Orange Theory.
isn't $10 a month.
It's not?
No.
It's more expensive?
The Y is.
Yeah, the Y is like probably like $30-$40 a month.
I think even more than that. Yeah, I think it's maybe 70.
Really? Yeah. And then what's the one in like Brighton, Pittsburgh, the fancy one?
Oh. Midtown. Yeah. Yeah.
I went to Midtown for 1 year thinking I'm going to use the pool and the sauna, and like, you know how fast life is. You're out in 45 minutes and an hour. You don't use any of it and you spend a lot of money.
If you're retired, though, you might want to fill your time, get a cup of coffee, start talking to everybody,
sit by the
social hour at the pool.
Network.
Yeah.
You network. Have you ever tried iFitness Plus at home?
No.
What's that?
It goes with your watch. It's an app with iFitness Plus, and it coordinates with your watch. And I have a friend that I do it with over FaceTime 3 times a week, and it's strength training, running, yoga, whatever you choose.
Like the workout plans on your watch.
So it coordinates with your watch, your fitness app.
Okay.
So it tracks everything
I know
for
what
you.
you're talking about.
iFitness Plus.
Is it like $9 a month, $10 a month?
It's $80 a year.
Okay.
That's cool.
Yes.
Oh, I love it. I love it. I've been doing it for almost 2 years.
That's great.
Yeah, I love it.
Yeah. My question to you about how long ahead, like before you turn 65, should somebody sit down with somebody like you?
I would say 3 months.
3 months?
If they're going to take their Medicare.
Yeah.
If they're not continuing to work and they're just going to, not take it. I would say 3 months, and they should apply for it 3 months ahead of their birthday. Okay. If they're going to continue to work and be covered under an employee group plan, it's good to take your A anyway, because then when you leave work and you want to just get your B, you can get your B much quicker than your A and your B. The reason to not take your A is if you are contributing to an HSA. because once you take any part of Medicare, you can no longer contribute.
I got you.
So you don't take your A, but if you're not any longer contributing, then you might as well take your A because it's free.
Yeah.
Even though you're still working. Mm-hmm.
I don't know about you, Dave, but I don't have a lot of clients that are, let's say, 50 plus that are contributing to an HSA. Most of them are on some type of copay plan.
Yeah.
It might be the younger folks, younger generation that are saving in these HSAs that don't have a lot of money yet.
I find that most people turning 65 that are going to continue to work take their A. They're not contributing, and they do take their A. Yeah,
I think
and
so.
And then it makes it easier. It's much easier to. I had somebody this week who was going to be retiring in November, and then they let him go sooner. So they needed their Medicare to start October 1st, and they were able to get it because they both already had their A.
Mm-hmm.
So they went right down to the local office, and they were able to get their B quickly. So it's easier if you already have your A.
Yeah.
Mm-hmm.
Yeah.
So much to know.
It is. It's like a whole department. I remember when we first became independent financial advisors, I was like, I think I told you the story. I was like, everybody was like, oh, you can learn Medicare on the side and do that as a side business. I did 1 year. I did under AARP through United Healthcare.
Yeah.
Oh my gosh. I was like, it's just so much information. I wouldn't be doing a service for my clients. 2-part. Number one, Medicare
Captive.
Clients
Mm-hmm.
by being captive. But number two, trying to know all of that information as well as being
Doing
like
what you
financial
do.
planner,
Yeah.
investment, analysis. You don't have enough, and maybe people are a lot smarter than me that can handle all that. But to me, that's just like, it reminds me of like a CPA and financial professional. Like, and they exist, and I have friends that do that. I just argue, jack of all trades, master of none.
Yeah, it's a lot. There's a lot to keep up with. You want to know what's coming, what changes are. The Inflation Reduction Act is changing some things with Medicare coming up. I don't know if you guys have ever heard of the donut hole.
I've heard of it. I don't know what it is.
Yeah.
So in things like that. So there's going to be a cap in 2025 on what the Medicare beneficiary can pay for their drugs. And the cap is going to be $2,000.
Is that good?
Well, it's a good thing for the Medicare beneficiaries. I just don't know how it's all going to actually work, like where that's going to, who's going to pay for it. So this year, the changes that we're already starting to see with the Part D, with the insurance carriers anticipating that, is premiums have doubled on some of the Part D plans. And the way the Part D works, it's structured with 5 tiers, and your drugs get put on these tiers. Well, some of the tiers are no longer co-pays, like a $42 copay for a costly drug. Now it's a co-insurance of maybe 25%, which will cost more. Yeah. So the costs are fluctuating somewhere. And so we want to keep up with those things to be able to help our clients as well.
Yeah. So theoretically, they're capped on how much they may pay. And I know this is kind of speculation, but now where at first they might pay $40 and have to pay $40 in perpetuity versus now you might pay 25% every time you take it out, but it caps you.
You might be paying $42 on a $500 retail drug.
Yep.
Now you might pay 25% of that instead of the 42.
Yeah. But they'll cap you at the 2,000.
Yes.
Okay.
Yes.
Wow.
Yes.
So theoretically you might have to come up with more money up front.
Yeah. I don't really know how it's all going.
Yeah.
That's 2025.
Yeah.
But we're seeing the impact of it already for 2024 in some changing.
Sure. Mm-hmm. Kind of reminds me of Social Security, the conversation with that, where it's like, hey, I think it's 2033, 2034, Social Security runs out.
Yeah, I'm glad you asked that because my mind was going that way. And I have 2-part question for you.
Yeah.
And I don't mean to put you on the spot.
No, I hope I can answer it.
Part 1. So you said 6 years in the business.
Yes.
What trends have you seen as far as cost and care? Has it gone down, stayed about the same? Because people always worry, and you think about Social Security running out of funding. What are they going to do to extend the life of providing these benefits through Medicare and supplement? Are they going to increase premiums, lower coverage, maybe extend that date from 65 to 68?
Yeah.
What have you seen in the last 6 years? Or not much?
I would say overall, my first thought is I've seen the Medicare Advantage plans become richer and a better option.
As far as what benefits they include?
Mm-hmm.
Really?
The Advantage plans.
Yes.
Okay. Wow.
Yeah. I think the trend is leaning more towards those.
Okay.
So this is getting a little bit granular, but when you have two ways to get your prescription drug plan. You can get it standalone drug plan when you have a Medigap plan, or you get it included in your Medicare Advantage plan. What we find on the formularies and the costs to the beneficiary is that when it's included in a Medicare Advantage plan, there's an advantage. The formulary is better. It costs less for them per drug overall, less deductible, things like that. So that's one of the trends of seeing a leaning that way, because the cost of Medigap plans are high, and then the cost of Part D standalones are high. The formulary is higher. So when you add all of that together, the Medicare Advantage plans are looking a little bit more attractive, I'd say, than 6 years ago.
And then the second part, follow up to that, is not just the trends, but what do you maybe forecast? Do you think that we're going to see some changes down the road? You think about the baby boomer generation, retired, and we've been seeing this with unemployment levels being so low and not enough people to come into the workforce and help pay into Social Security and Medicare and things like that. Do you foresee any drastic changes in like 10, 15 years?
I mean,
we're going to hold you to it.
I don't think so. I don't lean towards the fear mongering side of that.
Okay. Yeah.
And so I don't think so. I don't.
Yeah. I mean, even on the topic of Social Security, I had a meeting just yesterday, and this gentleman says, I don't think I'm going to be able to collect anything. I said, I don't think that's true. You're paying in. I think what they may do is toy with the idea of pushing out Social Security when you can collect, or your full retirement age, or the benefits, the enrichment programs, right?
You're already seeing that now. I mean, I guess I'd go with my grandparents' age, like the older generation, like when you hit 65, that was like full retirement, where now it's like 66.6 or something like that. And now it's pushed out. I think that's we're going to continue to see. Unfortunately, I do think, not to dive too much into politics, but because politicians are not on the Social Security system, it's not as hot a topic for them. But I tell you what, if you just got rid of Social Security, I think you'd see an uproar in this country. I mean,
be chaos.
To give welfare to people who do not contribute to welfare,
right?
But then to say you've contributed to this program your entire life, and now we don't have any money for you. I absolutely don't see that happening because of that. So I think they'll figure out a way. I just think it will evolve over time. I think it'll be, and as people continue to live longer too, right?
Yes.
Which is crazy, because somebody was saying, there was a politician, and I forgot who it was, Democrat, Republican, but they were like, I think people should start retiring later. And it's like, man, you're already 65, 67. How much you work your whole life? How much, farther do you want us to continue,
Right.
Well, you're on these cushy government pensions and stuff like that. So,
and with Medicare, Part A is free because they've already paid for it in their taxes. Part B, there's a premium, but they've already paid for that. So that's due to them.
I'm glad there's these programs in place, unlike retirement, where back in the day you used to have a pension, Social Security, a pension. This younger generation, if they're not saving on their own, there's nobody there to bail you out.
No.
Yeah.
To be sitting across from a client that's dependent on Social Security as one of their primary sources of income in retirement will not be a good conversation.
No.
Yeah.
No.
And that's what statistics say, is that like people are not saving what they're supposed to.
And they're not saving enough.
Yeah.
Yeah. No, that's scary. I don't know how anybody could survive just on Social Security.
No.
Brenda, I do have a couple questions for you, just in kind of closing here. A little bit off of Medicare, but kind of more about you and just how you got into this world. I know faith plays a big part of your life. Conz, I don't know if you know, but Dan, our pastor, he's our assistant pastor. That's Brenda's son-in-law.
I did not know that.
So when we talk about Dan and Dave,
he's
they're
my
our
favorite
pastors.
son-in-law.
Yes, the best. But I guess
He
if
is the best.
you could just kind of real quick talk about how faith plays a role in this job that you have, like with Medicare and everything that you do.
Oh, faith is everything to me. I feel I'm doing this because the Lord put it in front of me to do it.
Yeah.
And I really do try to do everything that I do to glorify him in it, in the way that I care for people, the time I put in, the investment that I make, how I do it, why I do it. It's 100% because of my faith.
Yeah. And I think that the reason I want to bring it up is somebody like Brenda is not somebody that, I always remember what your husband actually said.
What?
It's like, you got to watch out for the guys who give you a business card and it's got the little Jesus fish on it or the cross. And he's
Steve.
like, he's like, those are the biggest snakes. And Cons, we talk about this a lot where it's like the guy that's, saying he's a big Christian and like, he's the guy ripping you off. And how many times that happened?
I don't think you should have to tell anybody you're a Christian.
Amen. Yeah.
They should know you're a Christian by the way you behave.
Yeah.
And the
absolutely.
way you act and the way you love.
Yeah.
Mm-hmm.
And we all fall short. Like we're all sinners. We're all,
yes.
we're all going to make mistakes and stuff like that. And, and my mom, honestly, and my mom, you both know my mom.
I love your mom.
I love my mom too. But my mom right away, she's like, you don't need to go to church to believe in God. And I'm like, yeah, fair. And, it's like those church people are hypocrites. And I'm like, and I heard this analogy and it stuck with me. And they're like, when you go to the gym and you see that 350-pound person in the gym, you don't say they shouldn't be here because they're not in great shape. It's like, well, that's exactly why they're here. And I would argue that that's why people go to church and have faith, because they're not perfect, because they're trying to seek help from the one who is perfect.
Yeah. I for me, going to church every week, it grounds me. Yeah. Everything else goes away. I'm there to worship God, and I'm here to, I'm there to hear the word and to be encouraged and to receive from him. And it's my lifeline.
Yeah, absolutely. I feel like it's like you have like the Olympic torch I picture is like, that's church. And you go there with your little torch and you're like, all right, like you recharge it. Yeah. And then you go into the world all week and it like dims and you make mistakes and you get hit with stuff that you just never see coming. So then you get back to church to light it up again, to like, here goes a couple more days, And
every time I think about not going and I'm like, oh, I'm just too tired or whatever. And I go, I'm always just like, oh, I'm so glad I did.
Yes.
I'm so glad I did.
I've never gone to church and be like,
why'd I come?
Yeah, exactly. Kind of like the gym, though. It's like the gym for your soul,
It's true, though.
You never go to the gym.
It's my lifeline.
Yeah, amen. And and the one thing is I think differentiating from, so people that like aren't kind of like believing walking Christians is like, oh, they're a Christian or whatever, and it's like religion and faith, and so like people be like, oh, Dave's really, my dad says this all the time, just because he doesn't know English super duper well, he's like, David's very religious, and I'm like, I'm actually not religious at all. Like religious people killed Jesus, you know what I mean? Like Jesus did not agree with religious people,
Yes.
But it's people with faith, and that's why I refer people to you is because I know the quality of what you do behind what you do.
Thank you.
You know what I mean? Like, and it's like, it's more than, and I would argue, even with Monarch Wealth Management, it's like,
don't argue with Monarch Wealth Management. What would you argue about?
But it's like our lifeline, if you will, is that it's not just a job. It's not selling stuff. It's like, if I sit across the desk from somebody and you sit across the desk from somebody, at the end of the day, I just want to do what's in their best interest. If we do what's in their best interest, everybody wins across the board.
Well, and I can personally testify that you have sat across the desk from Steve and I many times. And I know that you have I have always known that you would just do what was best for us. And
appreciate that.
Love you guys.
Yeah. I love you guys too.
Seriously.
Yeah.
It's been, we retired because, you helped us. My husband retired.
Well, he put you back to work.
Yeah. He put me back to work.
That's right. Thank you, God.
He's like, Steve, you want to retire? Sure. Brenda, what do you? Brenda, how about doing Medicare?
Yeah. And then I just wink at your husband. I'm like, don't worry, Steve, you don't have to do a thing. You don't have to do a thing.
I love it. And he's my biggest supporter.
Yeah, he's a great egg. Your whole family, actually, I got to say.
Thank you.
But,
they are, though.
Yes. Cool. Cons, anything else?
No, I don't think so. I think you've actually made the process easy. One step, reach out to you, get a meeting. How do they do that, by the way?
They can call me.
Okay, so right from the website, the Medicare Marketplace.com.
I'm on there. Foster. I'm also on your website.
Beautiful.
Yeah, preferred partners.
I'm preferred partner. They can reach out.
That's
and call
the best way is to call you, not email. Okay.
No, they can email.
Or email.
Sure, email.
Okay.
Either text. Any of it.
Call, email, text.
Where do most of your meetings happen? At your office?
So, I'm glad you asked. So I have a satellite office in the Village of Spencerport where I live. That's my office during annual enrollments where I primarily meet with everybody. And then I have an office at the main, at Aaron's Benefit Company on Dewey Avenue.
And I assume that would be by appointment only, especially during
by appointment
open
only.
enrollment?
By appointment only. And they just opened a second location in Linden Oaks.
Awesome.
Mm-hmm.
Yeah, she's right around the corner.
So tons of options to meet with Brenda, talk about Medicare retirement and coming up with the best option for you. I think that's all the time we have for today. Thanks again for listening to the Pennywise Financial Podcast. Thanks again for coming on.
Thank you for having me.
Thank you.
You've been listening to Pennywise Financial, brought to you by Monarch Wealth Management. Constantine and David really care about their clients. They want to make sure you're happy, so you'll continue to hire them. There's no commitments, and clients are free to leave whenever they want. Think about being able to pick up the phone and call someone for guidance and advice on almost anything, from buying a car, selling a home, buying vacation properties, or even selling a business. Reach out on the website at monarchwealthmanagement.com. There are 2 offices in Rochester and 2 offices in Buffalo. Reach out to us on Facebook, LinkedIn, Twitter, and YouTube, or call us toll-free at 800-480-1580. That's 800-480-1580. Until next time, this is Pennywise Financial, signing off.
The opinions voiced in this program are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which investments may be appropriate for you, consult with your attorney, accountant, and financial advisor or tax advisor prior to investing. Securities are offered through LPL Financial, member FINRA, and SIPC.